Hi, my name is Elyssa, and I wanted to share my pocket guide assignment for this semester. So I chose to do mine in a binder with different tabs. I'm a very tactile person, so this is just what worked best for me. So I divided it up into a bunch of different tabs here. I have prevention, pediatric, pregnancy and postpartum, women's health, well adult, and well elder. So going into the first tab, my prevention section here, I explain a little bit about the different levels of prevention: primary, secondary, tertiary, their different goals, and a few examples of each. I then discuss a little bit about barriers to preventative care and what may hold people back from kind of getting the exams and tests that they may need that could lead to early detection or prevention. And then I discuss a little bit about information about screenings, nothing really specific, but different aspects of screenings, things like benefits and risks, sensitivity versus specificity. Then going into the pediatric section, I broke it down by age range. So I start with infants here, start with a head-to-toe assessment, different developmental milestones, some nutritional recommendations, some sleep recommendations, some information on elimination and what to expect with that, and then different safety measures that may be important for having a new baby at home. I then go into toddlers, again with the head-to-toe assessment, different language milestones, different developmental milestones, personal and social expectations, some information about toilet training, because that's when this starts. Then I move it into preschool age, again, head-to-toe assessment, developmental milestones, personal social milestones, cognition, and then again a little bit more about elimination. Toilet training comes into effect, is still in effect at this age, but bedwetting may also be a factor. So just some information about that. School age, 6 to 12 years old, again head to toe, developmental and motor milestones, cognitive milestones, psychosocial. This is when people really start to develop kind of those peer-to-peer relationships. And then scoliosis screening is also done around this age. So I just have a little imagery of that, just to a little visual. Adolescents go, again, head-to-toe physical milestones, psychosocial, and kind of sexuality becomes more important in this age, and some information on that should be discussed also when you're doing your exam. And then I added in a growth chart, a height and weight growth chart for pediatrics, a vital signs chart for pediatrics throughout the different ages, and then I have a visual vaccination schedule here. I then move into some more detailed information about immunizations and vaccinations that are often given or recommended during the pediatric period. Kind of some information that you want to give to families, risks, benefits. You want to give the information sheet that's provided by the CDC before you give any immunization. And then I go into the different specific vaccinations with some information, hepatitis B, MMR, Tdap, HPV, varicella, and just some information recommendations on those, as well as specific contraindications for each of those. So then I move on into pregnancy and postpartum period. So some information that you want to gather when you're doing your preconceptual counseling, getting a good solid history, family history, medical history from your patient. Then I go into pregnancy diagnostics, the different signs of pregnancy, presumptive, probable, positive signs, and then the different pregnancy tests that are given, urine, blood, stuff like that. Then I move into dating pregnancy, how pregnancy is determined based on the woman's last period, some information on routine prenatal care, the ultrasound schedule, the different labs that are done, nutritional education, genetic testing, hypertension testing, sugar testing for gestational diabetes. I put a little information on the scheduled visits, what they recommend for scheduled visits throughout a pregnancy, monthly visits until 28 weeks, bi-weekly 28 weeks until 30 weeks, 36 weeks, etc. And then I have some information about what some of the signs and symptoms that people may expect or may experience during pregnancy: nausea, vomiting, urinary frequency, constipation. I go a little bit deeper into some nutritional nutritional recommendations, how you want to increase your calorie intake and make sure you're getting adequate amount of folic acid and vitamins and staying hydrated. I go a little bit more into the physiological changes that a woman may see during each trimester of pregnancy, first, second, and third. I have a chart here that gives the weight gain recommendations based on the woman's prior weight before pregnancy. I then move into stages of labor, the first, second, and third, and what each one consists of and comprises of. And then I move into some postpartum education. I have here the nine B's that we learned about. I have some information on postpartum nutrition, especially if a woman is breastfeeding still. A little bit of information on breastfeeding itself, the risks, the benefits, the difference between colostrum and breast milk. And then for screening for postpartum depression, some of the interventions that may be helpful, some medications that may be helpful, and the different screening tools. One of the main ones that I found was the Edinburgh Postpartum Depression Scale, so I have just an example of that there. I then go into women's health and the different screenings that are specific for women. So I have information on cervical cancer screenings here, just some statistics about cervical cancer itself, information about pap smears and what they show and what they detect for, and how often you should get them based on your age and your risk factors. I also discuss the HPV vaccine a little bit further. Then go into breast cancer screenings, the importance of a self-breast exam, a little bit, kind of a step-by-step guide on how to perform your own self-breast exam. Then a little bit of information about the risk factors, certain risk factors for women who are at risk for breast cancer, and then some information further about mammograms and the frequency of which you should be getting those as well. And then lastly, I move into the well adult and geriatric section. I focus on the well adult assessment. I focus on the exam, on the office visit. Ask the patient what are their concerns. Kind of catch up on what chronic illnesses they have, how they're able to manage those. Ask about certain environmental and workplace safety, either in the workplace, also safety in the home. Do they have smoke detectors? That kind of stuff. Ask about their home relationship and home environment, if they're safe at home with their partners and stuff like that. And then a little bit more about cancer screenings that are appropriate for the adult population. Colon, lung cancer, prostate cancer, endometrial cancer. And then some nutrition education about proper nutrition, exercise, if smoking cessation education is necessary, seatbelts, sunblock, everything like that. And then another chart for vaccines that are indicated for adults. And then lastly, for my geriatric elder section, things that you want to focus on in your assessment is, that's different from other age groups. Their cognition, is their cognition still intact and sharp? How's their mobility, their functionality? Pain assessment, are they assess their driving safety? Also assess for depression, as that is harder to assess in older adults. And their different medications, as polypharmacy can be prevalent in older adults and can cause further complications. I then continue into nutritional recommendations, information on incontinence and the risk factors and the causes for that, some sexuality information, barriers to that and certain sexual dysfunction, and also further screenings and immunizations for the elders, such as the pneumonia vaccine and the influenza and the shingles, and I have a chart for that here. So that is my pocket guide assignment.